Welcome to our presentation for our AI-driven clinical decision support project that we are piloting at Prisma Health. Starting with some background. According to the World Health Organization, medication adherence has a greater direct impact on patient outcomes than the treatment plan itself. Non-adherence accounts for nearly 50% of treatment failures, approximately 125,000 deaths, and up to 25% of hospitalizations annually in the United States. Medication adherence may be improved when patients receive treatments tailored to their needs, taking their unique medical history, risk factors, and socioeconomic factors into account. As the most extensive healthcare system in South Carolina, Prisma Health is positioned to generate meaningful improvements in statewide health outcomes by addressing this challenge through innovative technology such as artificial intelligence or AI. To support this goal, the organization plans to develop an AI-driven clinical decision support system designed to integrate with existing electronic health record systems such as Epic and Cerner. Building on this foundation, the tool would incorporate a recommender system framework that ranks and prioritizes alternative medications based on the patient's medical history, previous adverse reactions to medications, and evidence-based resources such as UpToDate, LexiComp, the FDA and CDC databases, as well as organizational-specific policies and procedures. These alternatives may include medications within the same drug class with a more favorable side effect profile, drugs from a different class that treat the same condition, or dosage adjustments tailored to the patient's unique clinical needs. The ultimate goal of this project is to improve patient outcomes by increasing medication adherence rates. Leveraging AI to develop comprehensive and more personalized treatment plans can ultimately improve medication compliance and improve patient outcomes and well-being overall. We will now go over the scope of this project, starting with inclusions and exclusions. This project includes EHR integration. It will be able to extract and analyze pertinent patient data and integrate seamlessly into existing EHR systems such as Epic and Cerner. Data-driven decision-making. Information will be compiled from the organization's own policies and procedures, from medical databases such as UpToDate, LexiComp, Lippincott, the CDC, and the FDA, and we will develop and employ machine learning and AI algorithms to analyze patient data. The recommender system will rank alternative medication options by best fit for the patient based on data from similar patient profiles, evidence-based practice, patient allergies, demographics, previously tried therapies, side effect profile, risk of adverse reactions, cost, and other factors. Predictive analytics for medication safety. The tool will search for medication interactions, determine the patient's likelihood of side effects and adverse reactions, and provide a list of alternatives with evidence-based rationales. The tool will also have a user-friendly interface that is intuitive to use and makes it easy to input data. Rankings and alternative therapies will be quickly and easily identifiable. There will be clickable alternate care plans that providers can quickly pull into the note or prescribe without additional clicks or keystrokes, and it will be easy for providers to locate reasoning or rationale for AI decision-making. It is also important to note some key exclusions from this project. This project excludes direct clinical decision-making. Providers themselves examine and assess the patient and make diagnoses. This is a support and recommendation tool only. It does not diagnose or decide the ultimate treatment plan for the patient. It cannot prescribe treatments autonomously, and it does not include non-pharmacological treatment recommendations such as lifestyle or surgical interventions. This project also excludes patient portal integration. This tool will not integrate with patient portals. Patients would not be able to see alternative therapies providers may consider. This is for clinician or institutional use only due to the need for experienced clinical judgment when making treatment decisions. I will now briefly go over the deliverables which will define the project's tangible outputs. The system structure design documents outline the AI framework, EHR integration, and data security compliance. The AI and machine learning algorithms are the models for personalized medication recommendations and predictive analytics for adverse reactions. The EHR integration module is the seamless interface for clinicians to access recommendations within the existing workflows. The knowledge base is the evidence-based sources like UpToDate, Lexicomp, FDA, etc., and organizational policies. The user interface is the clinician-friendly dashboard displaying ranked medication options and supporting evidence. There will be a prototype validated through pilot testing and clinician feedback. There will be training materials as well as plans for maintenance and updates. Documentation will include the final project report, user manuals, and evaluation of metrics for performance and safety.
For this needs assessment, we looked at what Prisma Health would need to successfully roll out an AI-driven clinical decision support system, or CDSS. Right now, clinicians rely on manual data retrieval and personal judgment, and our current systems do not fully support real-time analytics or machine learning. Providers are interested in AI, but they still need clear training, workflow support, and guidance on how to use the recommendations safely and effectively. We also found gaps in our people, processes, technology, data, and governance. Our data are spread across multiple systems and need better consistency in organizations so that AI can use them more effectively. To ensure safety and accountability, we will need a strong governance group and an implementation team to manage configuration, testing, support, and workflow integration. Overall, the assessment shows that Prisma Health must strengthen infrastructure, data governance, training, and workflows to safely support a scalable AI-based CDSS. This pilot timeline spans about 32 weeks or 224 days, starting with one primary care clinic before expanding across Prisma Health. The discovery phase runs from December 1st to February 7th, about 10 weeks, and focuses on needs assessment, workflow review, and compliance. The implementation phase is February 10th through June 6th, roughly 16 weeks. And this includes system configuration, EHR integration, testing, and user training. The go live and evaluation phase runs from June 9th to July 18th, about 6 weeks, and covers the launch, support, and performance monitoring. Overall, the timeline gives us enough time to prepare, implement, and evaluate CDSS safely and effectively.
It is important to understand the current prescribing process and how an AI-driven recommender system can strengthen it. Clinicians begin by approaching the patient and assessing their symptoms, concerns, and overall health status. From there, they collect data such as medical history, medications, allergies, and lab results. After gathering this information, they compare treatment options based on guidelines, personal experience, and what they believe will best address the patient's condition. Finally, they review the chosen medication for safety, dosing considerations, and any barriers to access. Despite this structured workflow, many patients still experience side effects or inadequate therapeutic responses, which represents a key problem in the current state of prescribing. To address this, the proposed solution is to use the EHR as a foundation and integrate machine learning-based AI algorithms that can analyze patient-specific data and generate individualized medication recommendations. The result is a more personalized and evidence-driven prescribing process. This approach supports improved patient outcomes that align with both Prisma Health mission, value, and goals, as well as the patient's, reducing trial and error prescribing and supporting clinicians with real-time decision guidance. Currently, the process of prescribing medications is often unpredictable, relying heavily on a trial and error approach. Providers and pharmacists base many decisions on their personal education and clinical experience of current treatment standards. However, if clinicians are not consistently updated on new medications, alternative therapies, and dosing considerations, patients may not receive the most optimal treatment for their individual health needs. Personal preferences, both from providers and patients, can also inadvertently narrow the range of medications considered. When evaluating symptoms, chronic conditions, and overall costs, clinicians must be able to draw from a broad understanding of patient profiles, including age, gender, and medical history. Finally, insurance constraints add another layer of complexity, often limiting which medications are accessible or covered. These factors combined contribute to variability in care and potential delays in finding the most effective therapy. The future workflow highlights the continuous advancements in technology within healthcare in addition to a cohesive and comprehensive approach for providers. In developing the AI-driven medication recommender system, we are incorporating several key categories of patient data to generate a ranked list of medication options. These inputs include medical history, demographics, lifestyle factors, treatment preferences, and relevant genetic information. Within the medical history, the system places particular emphasis on chronic conditions, past treatments, allergies, adverse reactions, and lab values such as renal and hepatic function. Advances in genetic technology also enable us to analyze biomarkers and variances in genes associated with drug responses. As research in this area continues to grow, these insights will help clinicians better predict adverse reactions and medication effectiveness. Demographic factors such as age, gender, and ethnicity are incorporated to further refine accuracy. Lifestyle factors, including diet, exercise, smoking status, and medication adherence, also influence treatment decisions and expected outcomes. Additionally, the model accounts for patient treatment preferences, including cost considerations, route of administration, and dosing frequency. By integrating all of these data points, the AI-driven clinical decision support system supports Prisma's health mission and vision by enhancing patient engagement, improving patient safety, and ultimately strengthening clinical outcomes.
We will now go over the hardware of this project. It's the foundation that enables the software to function effectively, securely, and reliably. The physical component of the computer system, such as the server, the storage device, network equipment, computer, tablets, scanners, and other tangible technologies used to run software, manage data, and ensure the speed, safety, accessibility, and interoperability needed to support high-quality patient care. The hardware that we selected for this project is the IBM Storage Flash System 5000. It's an enterprise storage system that provides high-speed, all-flash, and hybrid flash storage solution for business of all sizes. With its high performance, is able to deliver fast, high-speed storage for transactional workloads, data reduction, which is compressing data to save storage space, scalability, offer both scale up and scale out capability to grow with your needs. The second hardware component that we picked was the Edge Gateway Server, Intel Xeon Server. It's a 8 to 16 core, 64 through 128 gigabyte RAM, encrypted SSD solid state drive for local storage, integrated with Fire/HL7 API connector, which mainly provide data transmission and communication function. Global system software is critical in electronic health record system. It ensures that medical devices, electronic health record, and diagnosis system operate reliably without crashing, direct supporting patient safety. System software protects sensitive data, patient data through encryption, access control, and audit logging, helping hospitals meet strict regulator requirements such as HIPAA, enabling interoperability between diverse systems such as lab system, image equipment, and EHR system. It ensures seamless data sharing and reduced error. System software manages the performance, stability, and availability of the healthcare application, supporting fast workload and continuous operation. As healthcare increase, adopt advanced technologies such as AI, telemedicine, and robotics, robust system software becomes even more essential to power and integrate these tools into clinical practice. Um, One of the software that we use in this project is application programming interface development, electronic record software, data store, comprehensive patient data, clinical and generic, AI algorithm program, and machine learning module.
The project budget focuses on the essential resources needed to implement this project. As you can see, our licensing is costing about $31,000, maintenance about $1,500, subscriptions about $18,000, hardware about $5,700, consulting about $19,000, and contingency costs and taxes about rounding up to $24,000. This adds up to a total of about $100,000 being allocated for this project. These costs are associated with licenses for 29 users, integration modules for Smart and Fihir and CDSS hooks connectivity, general training, and security tools to ensure HIPAA-compliant access and audits. Cloud hosting services are also included to support processing, uptime, and data protection needs for 1 year. Minimum hardware upgrades will be required as well, including a clinic server and 3 workstation licenses. Consulting costs will cover vendor-led training for clinical staff and 60 hours of project management to guide configuration, workflow alignment, testing, and go-live activities. Overall, we believe that this budget will ensure the pilot is implemented effectively, is compliant, and provides all of the necessary training and technical training necessary for successful end-user adoption.
Our project involves several key stakeholder groups. The project sponsor provides strategic oversight, and the project manager coordinates the timeline, deliverables, and the communication. The steering committee reviews our status and major milestones, while the clinical oversight committee ensures that the decision support system aligns with safe clinical practice. The workstream leads and subject matter experts contribute domain-specific expertise throughout the project. The development team handles interfaces and data mapping, and the testing team validates new functionality. The hardware team ensures the technical environment is ready for deployment, both on a hardware and networking side, and the EHR vendor integration team supports data exchange and connectivity. Together, these stakeholders support and guide the implementation from start to finish. All right, and as with any project, there are also some potential risks that are worth noting and planning for. First, we have scope risks, which include unclear requirements or potential changes to project parameters that could impact the project. Cost risks involve unexpected expenses or budget overruns. Schedule risks come from delays or dependency bottlenecks that may slow down progress on the project. We also have performance risks if the system fails to meet clinical or technical objectives. Technical risks, including software issues, integration challenges, or configuration problems. There are also communication risks that could occur between teams or the stakeholders, and operational risks that stem from day-to-day workflow disruptions. Finally, resource risks relate to limited access to required hardware, software, or complete patient data. All of these categories have the potential to affect quality, timeline, or system readiness, so they need to be monitored throughout the project. All right, we would like to thank everyone for taking the time to watch our presentation. We hope it was helpful, and we appreciate the opportunity to share our work. Thank you.